The OLLI programs basically all lost, almost all of them, all 125 of them practically, lost almost 40% of their attendees because everybody quit coming to classes, in-person classes. So many of them, including ours, switched over to having online classes. That didn't suit everyone, so membership went down across the board with many of them. They gave us basically 3 years to get back up to our over 1,000 members. Before COVID, we'd gotten as high as 1,300, but we were standardly over 1,000. So last year we got like to 946, something like that. So we need to kind of tip it over to over 1,000 this year. So we encourage you to bug your friends and family and anyone possible to come along board with you to attend classes, or at least become members. You can consider, you can't just automatically give them gift memberships, but you can find a way around the problem usually if you want to. But anyway, just wanted to clarify that. And as I said, we do welcome you today, and we welcome Sofia Pereira. She's currently Public Health Director of the Humboldt County Department of Public Health. She previously worked as a legislative analyst for the department from 2014 through early 2017, when she left to work as a community manager and then a program director for She Should Run, a nonprofit that focuses on increasing the number of women who run for political office. She returned to DHHS in 2019 as an emergency preparedness analyst for the public health branch and was promoted to program coordinator for the same program less than a year later. During the county's COVID-19 response, she served as operations chief, working closely with Stevens and health officer Dr. Ian Hoffman, excuse me, and overseeing approximately 200 staff working in communicable disease investigations, testing, human services, and vaccination. As public health director, she is responsible for the communicable disease program, its continuing expansion due to COVID funding, the public health clinic, public health nursing, environmental health, maternal, child, and adolescent health programs, including the Women, Infants, and Children Nutrition Program, the department's state-of-the-art laboratory, and a variety of grant-funded programs focused around improving the health of our community. She's got a big job. She also advocates for continued investment in public health by the state and federal government, and works with community partners on the Public Health Strategic Plan and Community Health Improvement Plan, with focus on long-term efforts to address health-related issues in the community. She formerly, while she was doing all this, she served as a city council member and mayor in the city of Arcata through 2021. Sofia holds a Bachelor of Arts in Communication from Humboldt State University. It's all yours, Sofia. That beat a one-sentence bio that you provided. I thought you deserved more.
Oh, well thank you. Thank you for that kind introduction, and good afternoon, everyone. Thank you so much for the opportunity to share with you some of the work that we're doing in public health. I was going to make a joke about, we do things beyond COVID. One of the things in public health that I think has been a part of the field is that, oh, what we do is behind the scenes. And if what we're doing is behind the scenes and isn't, if people don't know about us, it must be that we're doing a good job because we're prevention work. And obviously COVID showed us to the broader community. And I think it's a really great opportunity that we have right now to talk about some of the other work that we do. And one of the things that we do as a public health department under the Humboldt County Department of Health and Human Services is a community health improvement plan. And so I'm going to just pull up my presentation so that we can go over that together. Let me see. Okay, are you able to see it?
Yes.
Okay, great. Wonderful. Okay, so just for a little context about why in public health we do a community health improvement plan. We are an accredited public health department. So that means that we've been accredited by the Public Health Accreditation Board And that accreditation board sets national standards for what we should be accomplishing as a local health department. And so that way we are always continuously improving, making sure that we're addressing health inequities in our community. And one of the ways that we do that is through a community health improvement plan. And I'll talk about that in more detail soon, but I just wanted to cover kind of high level, what we're going to be reviewing together today. So we are going to review what a community health improvement plan is, the process used to develop the plan. We're going to talk a little bit about the public health frameworks that guide that process. And then we're going to go into the document a little bit. And I realize I don't have a link for you all, but what I'll do is when we start getting into Q&A, I will share a link to our chip. I'm going to call it the chip from here on out because it's pretty wordy. And I'm going to send you that link so that that way you can look at this document yourself and familiarize yourself with it. And then I'll be sharing also a little bit about next steps in our process with Live Well Humboldt and our chip, and ways that folks can be involved. And I realize that as we're moving through, I may not be able to see questions totally in real time. It looks like I can kind of see maybe when things are popping up. So I'll do my best to answer a question if it's relevant to the slide and it's something I can address head on. There may be questions that I'm going to be able to answer later on in the presentation. And so I'll do my best to answer in real time if you enter things into the chat. But I do understand that we'll have time for Q&A at the end of the presentation where, folks can, chime in with their questions and also put them in the chat. So I'll do my best to answer questions throughout the presentation. But I may have to reserve some questions towards the end in case I want to address it in more detail later on. So I hope that's okay with folks. Okay. So let me fix Zoom settings here. Okay, great. So I just wanted to give you a little bit of background about the community health assessment, the CHIP, and then what Live Well Humboldt is. So our community health assessment was published back in 2018. And what a community health assessment is a summary of data about Humboldt County's health. And so, and then looking at the factors that influence those health outcomes. So this is really the data that tells the story of our community's health, helps us better understand throughout the community, not just for us as public health, but community partners and the public to understand what is the state of, what are the leading causes of death in our community? What is the loss of life, from, suicide or other preventable deaths. So it tells us, the state of oral health. I mean, there's so many different things in this community health assessment. And we're going to be working on our next community health assessment in the near future. But just to give you context, that was created by a collaborative team of community partners and pulling information from a variety of sources to create that assessment. So the team that developed that community health assessment, really was focusing on data, how to inspire the community towards collective action. We don't want data to just be data that just tells us there's a problem. We want to use that data to inform how we respond to the needs of our community. In fall of 2022, we issued an update to our CHA, our community health assessment, and that included new data from the oral health program and the Allies for Substance Use Prevention Coalition. So we are trying to stay current, with new information as it comes in. In February 2023, we published the CHIP. So that's the middle picture here. And this was informed by the data in the CHA and sets out goals and strategies for the next 5 years. And the CHIP identifies priority areas, which I'll talk about in a little bit. But that's the purpose of why we're here today. We'll definitely dive in deep on that. And then lastly, we have Live Well Humboldt, and this is the community collaborative network that guides this process of the assessment, planning, and action toward health improvement. And we at Public Health are ushering the documents through this process. We are providing backbone support, but Live Well Humboldt really is bigger than public health. It's not just the public health department. It's bringing together community partners who are engaged in improving our community's health. And we will talk a little bit more about Livewell Humboldt as well, since that's why we're here. Let me just do a quick pause. I don't see any questions in the chat just yet. Okay, well, we're just getting started. So I wanted to share a little bit here about our process with Livewell Humboldt. So there was an interruption in our work on the CHIP during the pandemic, and we launched back in December 2021 data work groups around the priority areas that we identified. And gosh, I realized I should have organized this a little different, so I'm trying not to bury the lead here with what the priority areas are, so I apologize. I'll just kind of cover them high level real quick. So we have behavioral health as one of the priority areas, more specifically around suicide and substance use disorder. We have housing instability and homelessness as the second priority area. And the third is healthy beginnings and adverse childhood experiences, also known as ACEs. I don't think any of those priorities would be surprising to anyone in this room. I think if you were to talk to anyone just on the street and just go, what do you think are some of the most pressing issues in our community? These would be things that would be coming up, and definitely the data reflected that, and the community input reflected that as well as this community health improvement plan was being developed. So back in December 2021, we launched these data work groups. These were facilitated by our CHA and CHIP program coordinator, Ashley Gephardt. I have to give her a lot of credit for all the work that she's done around this process. And this really represents many hours of participation of approximately 140 community partners. And these data work groups, work together on each of these priority areas to summarize the existing work that is happening to improve community health, to identify measurable health outcomes that we agree to use to monitor our progress. What are the things that we have shared goals around, and how do we want to measure the impact that we're making on addressing those? And then lastly, integrating health equity into our work for improved health. And so many partners also took the time to look over that final CHIP document and really incorporate the feedback. So the document, while we as public health have published it, it really has included so much community partner input. And this is over 40 organizations that have partnered in Livewell Humboldt and the development of our CHIP. Okay, so as we think about our plan for improving health in our community, we consider what we're doing to improve underlying conditions. These are called the social determinants of health. A newer term that's getting used a lot in public health is the social drivers of health, and what we're doing to build resiliency early in life. So if you take a look at this, you see education, access and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. And that all of these things, all of these factors play a part in our individual health and our community's health. So these root causes, include the factors that I just mentioned, education, economic stability, the built environment, racism, and discrimination. Whether or not a population benefits from positive health determinants is often tied to historic and current policies that are rooted in systemic racism and other forms of oppression, creating health inequities. And this is what we see in the data as well. And then in our CHIP document, it does review specific data that is describing the social determinants of health in Humboldt. And the importance of the social determinants of health is that it reinforces the need to work collaboratively with multi-sector partners to address these complex issues. I think as you can see here, this isn't just healthcare or public health that needs to be in these conversations. It's involving our educational partners. It's involving local government that is, developing the built environment, neighborhoods, social community context. This is involving community-based organizations, economic stability, economic development, local business. This really, all of these factors play a role in our community's health, and we are continually working to bring in other other organizations into this work so that folks can see that connection between the work they do and how it impacts community health. So another consideration is health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. Unfortunately, our community health data shows that this is not the case. And in order to move the dial and health outcomes for our community, we need to understand the root causes of these differences. And the cause of these disparities for Indigenous communities, for example, is understood to be rooted in the historical experience of colonization, intergenerational trauma, and ongoing inequities due to the persistence of structural racism and policies and practices throughout society and systems. It is also acknowledged that tribal people are diverse and have demonstrated powerful resiliency and unique community assets that promote health and wellness. And this context is tied to all of the priority areas of focus in this CHIP. Input from tribal members and diverse community partners is essential to focus on honest and accurate descriptions of the inequities, and together with an understanding of community assets to help steer us toward effective policies and solutions for health improvement. So this is, again, just reinforcing the more perspectives that we have, lifting up the perspectives of communities that are experiencing disparate health outcomes is going to be key in us addressing those health inequities. And with all of that, how to do this is in actuality a very big challenge. It is not simple to do. This graphic, I think helps us visualize the vision of what we were working towards. And with, oh, sorry, I thought I heard someone. And I think just to close off this slide, I think it is really encouraging that there is so much work around advancing health equity and racial equity amongst so many local organizations and within collaborative community efforts. And so we're just really grateful to be a part of that process to improve access and opportunity to be as healthy as possible. Okay, so this is where I didn't mean to bury the lead, and I wanted to just give a lot of context to what we're doing here and our approach. But like I mentioned, the priority areas for the 2022 to 2027 CHIP are behavioral health with a focus on suicide and substance use, housing instability and homelessness, and healthy beginnings and ACEs. And these were selected through a series of community engagement processes in 2019. And this is including Humboldt County's Budget Roadshow. Providence St. Joseph's has a community health and needs assessment, and they have community focus groups that informed this process, and then several town hall events. And actually a list of this community engagement is in the CHIP as well. As a result, these areas of focus are aligned with several other plans, including our county strategic framework and Providence St. Joseph's community health needs assessment, for example. And one thing I just wanted to note that I think is really key here is that there are many collaborative groups that are already working to improve outcomes in these areas. And the CHIP process is about helping to coordinate the activities of each of these priority areas and identify relevant measurable health outcomes that community partners will use to track progress toward equity and improved health. So our role as public health is not to say we are the expert in all of these areas. There is expertise that exists in this community, and we are here to help bring folks together. And we have, the resources to provide that backbone support for this collective impact approach that we're taking. And so I guess keep that in mind also with your questions. I don't aim to and claim to be the expert in any of these areas, but rather, we are helping to convene the experts and the local expertise and perspective around the work that's happening locally. And in the CHIP, there is information provided about collective action for each of these areas. And we'll talk a little bit more about what the CHIP has in more detail around that, and how the CHIP also outlines some examples of the work that's happening in those priority areas. Because I think too often we can be very aware of the problem, and it's hard sometimes to capture all of the really good work that is happening in the community. So that's part of this process, is not only to move the needle in a positive way on the shared measures that we're identifying, but also to help tell the story of the work that is happening, that is powerful and impactful and serving our communities. So I think it's important to balance that with, hey, we have a lot more work to do. There's always going to be work ahead of us, and let's acknowledge the really good work that's happening that may not always get the credit that it deserves. So this just goes into a little bit more detail about that data work group process that I was mentioning previously. So just really quick, what these data work groups did in the development of the CHIP was, review, what data partners are already looking at. So what's the data that, folks working in substance use prevention and substance use work, like what's the data that they're already, tracking in their work? What's data that needs to be tracked that we don't currently have or would like to have longer term? So those were the things that were identified in those meetings, because again, there is power in, having the data and then using that data to inform the action that we take. And so then from that data review process, there was prioritization. So these work groups determined what data would be shared in this newest iteration of the CHIP. And then also what will be in a community health data dashboard that we will talk a little bit more about too. And then lastly, the other piece that's really key to the CHIP is the asset mapping. So this is creating strategy maps, identifying additional community assets and who is doing the existing work. Because again, we need to acknowledge the work that is happening, and also for us to better understand, with all the goals that we've identified, are folks, do we need more focus in a particular area, for example? And let me just check. I see something in the chat. Could you possibly list some examples of the 140 groups that you're working with? Yes, absolutely. So don't quiz me on all. So it's over 40 groups, and I would say 140 participants that were active. That's probably just the distinction. This is listed in our CHIP towards the beginning, but for example, we had, United Indian Health Services be really active, the Iraq Tribal, Wellness Coalition, Providence St. Joseph's, we had Open Door, we had Humboldt County Office of Education. I'm blanking, but we had a pretty big variety of groups that were involved, and so we could pull up that list towards the end of after the presentation during Q&A if folks are curious to see that list as well. Good question, Jane. Oh, hold on a second. Okay, so next we are going to talk about these strategy maps, just to kind of help you conceptualize like what that is, because some of this is really meaty, and frankly, I think this is a good primer for you to look at the document in more detail and get familiar with it. So through the CHIP process, we did decide to build a strategy map for each priority area to try to show high level what is already being done. To do that, we partnered with the North Coast Health Improvement and Information Network, NSHIN, to talk to and learn from some of our collective impact coalitions that are aligned with these priority areas, initiatives and projects about the work that they are doing in these priority areas. And so there's going to be continuous work on this as well. So on some level, when you look at that CHIP document that was published, February of this year, there's lots of work that has happened since then that we're going to be working to provide updates over time. So this is the strategy map. I'm just going to show one strategy map because again, the purpose of this presentation is to familiarize yourself with the CHIP and the process that we have taken around this and the initiative Live Well Humboldt. but there are obviously lots of detail that could be, you know, we could dive into around any of these goals and these strategies. And again, my perspective here is about showing you this plan. And I'll do my best to field questions that you may have, but there may be more technical or detailed questions that are not public health's role, but perhaps the community partner's role. And so I don't want to speak for a community partner on that. So I'm just giving that caveat as you're maybe formulating your questions. So this is the strategy map for the behavioral health suicide prevention goals and strategies section. And you can see here that there are 4 goals for this section and a spectrum of strategies that are being implemented. So, you know, you can see goal number 1, establish a suicide prevention infrastructure, and then you can see the matching strategies that are connected. And they're, you can see the dots that are meant to just illustrate how it's connected back to the goal. And over time, as we're updating our chip, we may be finding that there's additional strategies that would get added to this map, right? So this is really just a snapshot in time. So just to give you an example, you know, I'm going to just go over each of the priority areas and just pull out a goal and then just give you some examples of the work that's happening. And what the chip is really intended to do is highlight that work. One of the aspects is highlighting this work. So for example, suicide prevention. Goal number 2, minimize risk for suicidal behavior by promoting safe environments, resiliency, and connectedness. You know, while suicide is a significant public health issue in our county, there really is hope. And I think that's something that's important to note in this work that we're doing. The evidence for effective suicide prevention practices is growing daily. And this chip is trying to capture that. So, for example, the Humboldt County Suicide Prevention Network and Yurok Tribal Wellness Coalition Suicide Prevention Task Force are 2 examples of partnerships that are providing impressive leadership for suicide prevention in Humboldt County. I just wanted to include, you know, some flyers of work, you know, just highlighting the variety of work that is happening just in one goal. So, some other examples of strategies supporting this goal: collaboration with firearm retailers, safety instructors, and gun range owners to reduce access to lethal means, educating retailers on suicide prevention strategies and how to recognize risk for suicide. And then another example is our Keep It Safe program campaign to encourage the use of lock boxes and cable gun locks. So, you know, those are some examples of like the really tangible work that is happening in just one goal under suicide prevention. Okay. Let's go next. Okay, so the second priority area within behavioral health is substance use disorder. And, you know, again, the chip will provide more detail around the strategies, the goals, and the measurements. Some examples of networks that are providing community leadership to this work are Allies for Substance Use Prevention, UIHS Opioid Awareness Coalition, RX Safe Humboldt, Yurok Tribal Wellness Coalition, Humboldt's Harm Reduction Coalition, and Humboldt Community Health Trust. So these multi-sector coalitions have focused on various strategies, and these include developing and disseminating safe opioid prescribing practices, hosting youth engagement and substance use prevention activities, promoting policy development, raising awareness about local substance use disorder resources and services, and increasing access to treatment, advancing harm reduction, reducing stigma for individuals living with substance use disorder, and hosting trainings on and distributing naloxone, also known as Narcan. So those are just some examples. And then so you can see here, goal number 3 is to reduce harm associated with substance use. So reducing the harmful effects of the disease to improve quality of life and decrease disease complications is the cornerstone of all chronic disease management. An example of this is the many organizations that are working to increase naloxone trainings and distribution. So while we have more, in 2022, we had more than 70 confirmed overdose deaths. So that is a stark number. And we had 374 community overdose reversals with naloxone reported between April and December of 2021 when RxF Save Humboldt began collecting data. So we probably have some more current data on that, but that's self-reported data to show, there also is a lot of effort that's being done to prevent overdose deaths. And so that's an important thing for us to note with the data as well. So as we all know, housing is an important determinant of health, and there's no one agency that could do this complex work alone. And there are many dedicated partners involved in various aspects of it. So one of the goals Livable Humboldt identified for this priority area was goal number 2, increasing access to supportive services for people who experience or are at risk of experiencing homelessness. As you are likely aware, there are many examples of creative and exciting initiatives supporting this goal. Some relatively recent examples: Arcata House Partnership, had new units to house up to 54 people experiencing homelessness at the Grove in Arcata, and a project that includes case management and connection to specialized services. There's work that's happening around housing transition navigation, housing deposits, post-hospitalization housing, day rehabilitation programs. There's a lot of work that's happening in this area. And then the last priority area, which really is like the foundation for, if you think about these other priority areas, the first 5 years of life, early childhood, healthy beginnings is just a key thing that affects longer term health outcomes. So it is widely understood that a person's experience early in life strongly contributes to the health issues that we have just discussed. And this knowledge presents an opportunity to focus on prevention by ensuring that all children get a healthy start and promote resilience to mitigate the risks and impacts of adverse childhood experiences, also known as ACEs. So as you know, First Five Humboldt has been an incredible leader in our community. If you're not familiar with their work, they do a range of things from First Five play groups, which I've taken my son to policy work and working with the county on developing supports for childcare providers in our community. So the range of what they do is major. So there's a lot more information on their website about their approach, and that's all scientifically supported. So goal number 1 for this priority area is to promote a healthy start and ongoing protective factors for children and families. Strategies included for supporting this goal. It's many different programs that you can see on this slide. We see, Paso a Paso. We see the Humboldt Network of Family Resource Centers. Open Door is doing great work around ACEs screening and treatment. Same with First Five. We have in public health, we have our Nurse Family Partnership home visiting program, which works with first-time moms from pregnancy up to 2 years of age. Together, these approaches aim to coordinate, culturally congruent services for children and families through the different stages of development. And so examples include that employing of healthcare navigators as a part of prenatal care and birth. I think that's First Five, parenting classes, Nurse Family Partnership that I mentioned, and then lots of other supports through community partners that you can see on this screen, and more that are not listed on this screen too. And so for each priority area, there is also a section with data that describes the health issue with specific indicators. So I wanted to show one example using suicide as an example. So included are comparisons of Humboldt County to the state and national data where it's available. There is also a section describing disparities within the county by various population groups, such as race, gender, sexual orientation. And finally, you'll also notice a target for each indicator. The number is our collectively agreed upon goal for the work of the 5-year plan and is based off of Healthy People's 2030 targets. And this part of the plan was created through the participation of many health improvement leaders in the Live Well Humboldt Data Work Group meetings held over the past year, past couple of years, and is providing that data-driven framework for tracking our progress. So I just wanted to show that as an example of how we're really trying to get to that place of shared measures, and then, having those shared targets of how we're going to move the needle in a positive direction in these priority areas. And again, when we say that it's Live Well Humboldt, it's community organizations, and the systems that are doing this work. Okay. So where do we go from here? We published the CHIP back in February 2023.
I'm sorry, Sophia, you have a couple of comments in the chat.
Oh, great. Okay. Okay. Let's see. I see, how could you explain ACEs, how data are collected and evaluated, and what we know about behavioral outcomes? Let's see, I think maybe I got this question before I spoke about ACEs, just looking at the time. Perhaps we can save that for after, but in terms of we need to talk more about ACEs, but how data is collected and evaluated. That's the process through this CHIP. So the CHIP is going to highlight some of the data. And I wish that the example I gave was perhaps from ACEs as well, so that you could see that, but it's in the CHIP document that shows. And again, maybe that's something that we can pull up together in the Q&A. And then I see another question. Okay, I see, Joanne, your comment notes that housing is important, yet some formerly homeless with substance abuse, especially alcohol, just gets put behind closed doors with no consistent counseling and social work. Thank you for raising that point. I think this speaks to, the increasing need for services and supports and the opportunity that we have to continue to build that. Why is the suicide reduction goal so small, since our rate is so out of line with state and country numbers? That's a really good question. I don't want to speak for the suicide data work group, but that was based off of organizations that are working on suicide prevention. And so the targets are reflective of their collective analysis of the data and what they felt was a reasonable target. Obviously, there is the work to strive to zero. And of course, to remove all health disparities. And so I think there's that balance of the vision is we want to get to zero, and we recognize that we are, continually working to address these health disparities and these health outcomes. And so again, I don't want to speak for that group in particular, but it was based off the analysis and the decision of those that are working in that field and have that expertise. But I see where the question is coming from, because of course we want to strive to zero. Thank you for these questions. These are great questions, and I look forward to us having some more conversations. So I just have a few more slides. So so I just want to talk a little bit about what is Live Well Humboldt, and how does that kind of shape what's coming next with this work. So I think these questions really coming in are highlighting the challenge where we can see that there's resources and efforts that are contributing to health improvement for our community. That is quite impressive and should be acknowledged, and the challenges are enormous and complex. And so Live Well Humboldt is a collective impact initiative that provides backbone support to improve how we work together. And so this includes supporting the conditions of collective impact. So this slide kind of outlines how we describe what Live Well Humboldt is doing. So it's aligning those community priorities, resources, and actions. It's anticipating and managing change through centralized data collection and analysis, identifying those shared measures and targets, engaging the community and creating broad multi-sectoral ownership for issues impacting county residents, and then eventually really mobilizing that public support for policy systems and environmental changes that advance health equity and support improved community health and wellness. And this work is iterative. It takes time to build that collective impact, to make sure that you're continually adding other voices and perspectives to that work and resources to that work. So, you know, as I'm presenting to you here, I don't come with, we've solved it all. We have coordinated everyone and we have a magical plan that's just like in 5 years, we're going to resolve all these issues. But it is a place where we are starting, that has started years ago, and to acknowledge the work that has happened before me to get closer to that place of collective impact and accomplishing these tasks. And we've made a lot of headway just in the past couple of years after we got through some of the worst of COVID. Okay. Sorry, my screen's slowing down a little bit. Okay. So one of the things I'm really excited about that will be hopefully coming out sometime in November. I don't want to give a launch date because it's a little bit out of my hands. But one of the things that we are working on is the Live Well Humboldt Community Health Dashboard. And so this dashboard is really a key step in democratizing the data that we have in the community health assessment. We'll be updating that community health assessment, and that data will be interactive instead of just being a PDF. It'll be an interactive, website and dashboard for you to see the data. This website will also show the community health improvement plan. It'll show the priority areas. It'll show the strategies. It'll show updates about that work that is happening. That's really exciting. This just goes into a little bit more detail about all of the possibilities with this website. So we are working with a vendor called Conduent, who works with public health departments across the country to create these types of dashboards for, community health data. And so there is going to be access to lots of community health indicators, lots of data visualization. You'll be able to compare our community's health data to others in California and across the county. Over time, we'll be able to add our own local data. Right now, what we will first launch will really be showing the data that's currently publicly available through data sources, that currently exist through, the CDC or California Department of Public Health or the Healthy, People's Survey. And so these are things that will get collated into our own Live Well Humboldt dashboard. So it's all centralized for you. You don't have to go chasing the information on different websites. So that's going to be a really nice feature. Also going to be great ability to create customized reports and dashboards that include maps, charts, tables, and graphs. So let's say you're a part of an organization that is working on, it doesn't need to be one of the priority areas. You could be working on HIV and AIDS, and you could pull up data around that's publicly available and be able to create your own customizable report. So the point of Live Well Humboldt is to be a place where people in the community can see the state of our community's health through this data and engage with the tools to better understand the resources that are the work that's happening as well. So, tracking that progress, highlighting and connecting the work that local coalitions are doing in our county. We'll be able to include other partners, reports and plans. There's also a database to show best practices to improve health. And then over time, we will be able to have the functionality to curate, national available grants, and eventually we would be able to curate local funding opportunities as well. But, we don't want to get too big for britches. We need to build this as we go, but that's just the capability. And we're really going to focus on getting that data onto the dashboard, and then, really getting the chip onto that website so that folks can engage with the chip beyond just the PDF, but actually just see like what is the work that's happening, what's the progress, and be able to look at that data through that format. So just real quick, just wanted to show just a timeline. So I mentioned 2018, we published our CHA. Live Well Humboldt was born then. 2021, we launched these data work groups. 2022, the work of those work groups concludes. We draft the chip. We published it in early 2023. Last month, we kicked off what we're calling the Live Well Humboldt Design Team, and that is bringing together, some core organizations that have been involved in the chip development from the very beginning, and helping to develop that structure of Live Well Humboldt. Because while we're providing backbone support, there are so many organizations and coalitions that are doing the work in the priority areas. So we want to make sure that we're not duplicating effort. We're meant to be supportive of the work that's happening, and how do we help make those connections. So that design team has just kicked off, and over the next year, we'll be helping, develop that structure and updating the dashboard. And then we plan in November to launch the dashboard, as I mentioned. And then more specifically, this is just some of the things that the design team is working on. Like I mentioned, data dashboard, helping to develop our next assessment, developing that Live Well Humboldt leadership structure. And throughout all of that, the foundation is equity and community engagement. So it's not meant to just be a room of some people deciding all these things, but bringing together the experts in their respective fields and helping to develop that plan for developing that structure. So we covered a lot of ground. Thank you. I'm gonna stop sharing my screen, and we will take questions and perhaps have some conversation.
And there's more questions in the chat.
Great. Yeah, I'm taking a look right now, Jane. So I see, and Jane, you have really good questions. Okay, so let's see, is there a formal method for evaluating outcomes relative to the objectives? We need to see if I can answer that question first. So in terms of tracking the progress of these goals, that's one of the things the Live Well Humboldt design team is going to be determining. But really, it's the data that over time is going to help reflect the outcomes, right? So that's why those targets also, I think, when we saw that suicide example, you see the target is something that could perhaps be reached within that time frame, right? And so the targets are meant to be reflective, like, okay, within this time frame, what can we achieve with our collective effort? So, I think it's the data that is mostly going to be used to help articulate that movement. But it's going to be the design team that's also going to be determining, as Live Well Humboldt, how are we checking in on the progress of the work? So not just looking at the data, but how are we updating the strategy maps to show the work that is happening? Perhaps there are new initiatives that weren't initially captured that we need to capture. Maybe there's other groups that are now engaging in this work that maybe weren't previously. So there's no clean method for that other than being open to updating the processes as we go. And the design team is going to be really key in helping us formalize a process around the updating of the data, updating the strategy maps that fit under those goals. And then let me see.
For example, St. Joe's is providing now a 55 bed facility.
Mm-hmm.
Where do you find that kind of thing on your database or relative to your goals? And are there lists of these activities occurring somewhere?
Yeah, so some of these strategies are going to be highlighted in the CHIP document. But again, that's a snapshot in time from when we published it. So that's a really great example of something that may have gone live after this document was published. And that's why having the website is going to be really key, because then we can show in more real time updates as they come. We haven't decided, there hasn't been any decisions made about like the cadence of how those updates are made. But for example, like St. Joe's is a really key partner. And so we are aware of like, okay, like they can provide updates for that work. So we haven't decided the exact process for that. But that's a really good example of something that we would want to update in the strategy maps and show that progress in housing instability and homelessness.
Now, I mean, there's a really interesting issue. You can spend most of your effort delineating the problem, which makes everything look bad. And then you can spend a whole chunk of time saying, here's what's being done, which stimulates everybody to do maybe more, and encourages them to do so. If you can have like model programs or suggestions of programs people could do or that everyday people can do.
Yeah, Jane, I think you've really captured, I think, the balance of that work, right? And the website over time will be able to show best practices. Conduit kind of compiles evidence-based practices, promising practices that, you know, any public health jurisdiction, if they have this website, they can share that information. But over time, we could show local best practices. But again, that's probably some time from now. But that is a potential, and that is something that Live Well Humboldt is really going to be about. It's not just compiling data that just exists everywhere else, but also what is the local data, the storytelling of, you know, what's the qualitative data that is missing from the quantitative data that we're seeing, right? So that's the other piece that we're going to be working on also from a health equity perspective, is that we recognize that not everyone's experience is accurately reflected in the data, or there's gaps in the data, and qualitative data may help us have a fuller picture of what's happening on the ground. Let's see. Do you have some provision for the public to contribute data? We have such good questions. So, and this is where the design team is that's one of the things they're gonna be figuring out, is like what is our process to add data and have that balance of a health equity lens, and what's the standard for data, right? So that there is some level of vetting to make sure, you know, that that it's sound, or that if there's limitations, that it's accurately explained and reflected. Like, here are the limitations of this data. Here's why it's still important that we share it. So those are things that the design team is going to be determining as well. And then community surveys are a great example of like community data sources that over time could be added to the dashboard as well. And then I see, if a goal is reached, as the goal increased to achieve even more during the time period of focus. Great question. I would imagine so. I don't want to speak for the partner organizations and the coalitions that make up the work around these priority areas, but I would presume that if we were to achieve in 1 year, like, you know, we met our target, that we would then want to further, you know, expand that goal, expand that target.
Are there any other questions? Sophia, are there other communities that are doing a similar kind of dashboard? This is from Lee.
Yes, Marin County has a similar kind of dashboard. I was trying to think of some other California counties, just because I think that's more relevant, but lots of counties across the country are taking this approach. Marin County is one. I believe Santa Cruz County is another, and I would need to think of the others that that we referenced kind of early on in this process. But yes, there definitely are examples of this being done in other communities, which also has made it much easier for us as being a smaller resourced county to know that, you know, this is a very established process, and it's been a very organized process for us to develop this website and this dashboard.
And Anna asked, is the increase in physicians in our area one of the goals?
Oh, good question. I would need to look up the priority areas. I'm imagining that would probably be something under like substance use as one of them, but I wouldn't know off the top of my head. But I could pull up the document. I said I was going to share with you all the links, so why don't I just do that right now? Hold on a moment.
That'd be great.
Okay, and I stopped sharing my screen. Okay. Sorry, I just have all these windows open. I'll spare you. Okay, so I'm just working to pull up the link. And I apologize, I didn't have it ready to go. But I'm going to share with you the link to our public health data page. Eventually, we will have a website that you'll just be able to go directly to for our SHIP. So, but if you go to that page, you'll see a link for the 2022 Community Health Improvement Plan. So let me look up. Since we're going through the document, there was a question in the beginning about partner organizations. So let me share my screen again. So you can see this document. Okay. Okay, so here is where you can see under the acknowledgements, the variety of organizations that have been active in the development of the chip. And then
That's
also
great.
coalitions that have been involved that you can see here at the bottom. So yeah, definitely, this is not an exhaustive list in terms of like where we want to go. Like we want more organizations to be involved in this work. If I'm trying to think of the best way to collect that information, perhaps people want to, if you have an organization that you think would be interested in being involved in this work, if you could just maybe put in the chat your name, the organization, and some contact information, we can definitely check with our staff to see if they're already on our list or get them added to our email distribution list. Okay, and so then the question about physicians, okay. I'm just trying to think of the fastest way to get there. Okay. I'm gonna look up substance use just to see if that one has that example. Okay, so we see the strategy map for, oh, that's suicide prevention. Well, we'll look really close there really quick, see if there's anything around providers. Okay. And then substance use. It's possible that some of these would probably include work around increasing number of providers. Like when I look at, increase availability of and access to medication assisted treatment or improved coordination of care, provide treatment and support services for SUD. I would say those are examples where looking at workforce would likely be one of them. And then one of, we have obviously various partners that are engaged in this work that do, workforce development. One is Enshin, which I mentioned before, North Coast Health Improvement and Improvement Network. Sorry, all the acronyms. They're doing some work around workforce as well. But there's many organizations like Open Door who's involved in this work, St. Joe's that are actively working on this as well. So, so yeah, it doesn't say, it's not explicitly stated here, but it's under, I could see the connection of workforce with some of these strategies that have been identified. Good question.
And Joanne McGarry comments, countywide, there are many services available, but it's not always easy for people to access such services if they are not located in their own community. In Arcata, for example, any services for the unhoused are only available, it just jumped on my screen, inconsistently, and only one organization gets funding and resources. We need more than AHP, or Arcata House Partnership, to be visible and working regularly and collaboratively with AHP to provide full services for the unhoused on a daily basis, not just Monday through Friday, 1 to 4. Okay. Any other questions or comments? If not, thank you ever so much, Sophia. This is quite a task for you all to handle. It's enormous. And you look like you've been attacking it from a very thorough perspective. So good for you. And we'll be awaiting further information and get a chance to look at what's been being done and keep track of what's going on. And I'm sure there are any number of members of the community that would be interested in assisting you with ideas if you want to have them contact you, or you want to contact them if you know of people to do this. Julie, you had a question? You want to unmute, or are you just clapping? I think she's clapping.
Thanks, Julie. We'll take the clapping, and you know, I really appreciate, Jane. Thank you for the invitation to present here.
Well, you're most welcome.
Well, and I would say I'm presenting work that, like I mentioned, has happened before I came into my role. Ashley Gephardt, who's our lead on this work, has been pivotal in it. We have a whole team that's working on it, and we're just one piece of it. Like I was saying, that all the organizations that are working on this. So I'm privileged to present on it, and you know, it is really the work of so many other people. And I just happen to be the lucky one that gets to like share
present it
with all of you. Yeah.
Well, that's what you studied, to be the communicator. So
There we go.
Yeah. I want to let everybody know that next week, this will be an example of what the League of Women Voters is working, because they've just undertaken a 2-year study of local behavioral health services, from which they've derived a new advocacy position on the topic. And they'll be talking next week with Molly, Kate, and other members of the League. So feel free to come back and learn more next week about one piece of this. And thank you ever so much, Sophia, for participating.
Thank you all. Thank you for your time. Take care.
Thank you for yours and all you do. We'll look forward to seeing you.